Hello to my fellow people with type 1 diabetes. This is Dr. Jody Stanislaw. And my question today is, how can you go for an hour walk and not go low? That is possible. Do you know how to do that? Okay, so if you're just finding me, my name is Dr. Jody Stanislaw. I have had type 1 for 40 years. Let's see how my number is doing today. Pretty good, I gotta say, pretty good. Look at that. This is what I can teach you how to do. This is what I teach all my patients. I have a virtual practice. I work with patients all around the world. I also have online courses. And so I am here to passionately help people with type 1 diabetes get better blood sugars. Because I've had type 1 for 40 years. I've dedicated my career to helping us with type 1 because I don't feel like the care that most type 1s get is adequate to allow you to feel successful with a healthy A1C. Right? The norm is kind of like, we got an A1C, don't be too judgmental of that. If you're having highs of 200s all the time, you know, you're doing the best you can. But I'm here to say that we deserve better care and we deserve better education and you deserve better support. So you can feel healthy, take great care of your body and get great blood sugar levels. So my patients, you know, their A1Cs are in the 5s and 6s, and sure, I have some patients in the 7s and 8s, but we're working on getting it down because that's what we deserve, especially in this whole COVID time, right? We need to have a strong A1C, a healthy blood sugar levels to keep our immune system strong. So if you're struggling, pay attention to my videos, check out my website. I've got lots of resources for you to help keep your immune system strong. So how can you go on a walk and not go low? That is the question, right? So how you can go on a walk and not go low is it's all about the insulin you have on board. Insulin is what makes us go low, not exercise. Think about that. If you didn't have any injected insulin in your body, which I do not recommend because that could put you at risk for DKA, which is dangerous. So just hypothetically, if you didn't have any injected insulin in your body, assuming you're type 1, you could be active all day long and you would not go low. Okay, so it's injected insulin that's inefficient that makes us go low. So it's very important that you know how to properly dose your long-acting or your basal rate and your rapid or your bolus to know how to have just that sweet spot of insulin that allows you to go on a walk and not go low. And that's totally possible, okay? If you have too much insulin and you go on a walk, that's when you go low. If you have too little insulin and you go on a walk, you actually could go high or go into DKA, right? So you've got to find that sweet spot. That's what allows us to work out for an hour or more, not have to stuff our faces with food, which I used to always have to do when I was little, because that's what I was told, and not go low. It's absolutely possible. So if you want to master this, if you're struggling, I have a simple course that will absolutely change your life. It's called Mastering Your Blood Sugar with Exercise, and you can find it on my website, which is drjodynd.com, listed right there. Click on T1D classes, and you'll see it. It's that simple. It's a series of videos, 5 to 10 minutes each, that will teach you how to go on a walk and not go low, or go on a hike and not go low, or frankly, go to sleep and not go low, or go on a bike ride, or be active, or garden, right? We can, when we know how to dose our insulin properly, we can learn how to be active and not go low. So that is my tip for you today. I've been coming live on Facebook since end of March to kind of inspire this T1D community during COVID with important information for how to get great blood sugar levels. So please, I encourage you to check out that course, Mastering Your Blood Sugar with Exercise. Even if you don't consider yourself a big fitness person, you move, right? You walk around, you clean things, you move things around, maybe you garden, maybe you go to the mall, maybe you play with your kids, right? You're active. So we need to understand how activity affects our blood sugar level so we can reduce our chance of lows. So that's what I'll teach you in Master Your Blood Sugar with Exercise. It's a very simple course. You can find it on my website, which is listed right there, Dr. Jody ND. So please comment below, what did you like about this video? What would you like to hear in other videos? And please, anybody you know with type 1, let them know I'm out there. Share this video with them. So thanks for watching and have a great day. Bye for now.